You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1547, featuring Dr. Johnson with a little chat about hind limb symmetry, or lack of it. And we'll get right to our tip after we hear from our sponsor.
Easy, effective, and eco-friendly fly control starts with fly predators. Fly predators are the organic, natural way to dramatically minimize your fly problem. Learn more about fly predators and other Spalding Labs fly control solutions at Spalding, spalding-labs.com.
Last time we were talking about, we'd started the discussion of hind limb symmetry, and specifically we had discussed two aspects of that, muscle atrophy and swelling in the hind limb. And today we're going to continue on the discussion of hind limb symmetry, and we'll look at both bony asymmetry and differences in fetlock height as they relate to asymmetry in the hind end. So the first area that I want to talk about, again under the bony asymmetry topic, is asymmetry in the tubercocci. And now the tubercocci is the point of the hip, and asymmetry in the height of the tubercocci can be associated with many different types of pelvic fracture. This is probably one of the most common fractures that you'll see, or a fracture of the tubercocci is one of the more common types of pelvic fractures you'll see, and it's commonly referred to as a knockdown hip. And that the classic origin of that, or how that happens frequently, is the horse goes through a stall door that's not completely open, or goes through an opening that's too narrow and bangs the hip and just knocks off the end of that bone. Not necessarily always associated with lameness. And the next area of asymmetry that I'd like to talk about is the tuber sacrale. The tuber sacrale would be if you're standing behind the horse, looking at the horse, the topmost portion of the rump is the tuber sacrale. And frequently, you'll hear the terminology a hunter's bump. And a hunter's bump describes the prominence of the tuber sacrale. Now, this really develops surrounding musculature, or it may be a result of a change in position of one or both tuber sacrale. And it can also just be the horse's conformation, so a kind of a range of things that can cause that hunter's bump and what it may be a reflection of. One thing I do want to sort of backtrack a little bit and remind our listeners of is that when we're looking at asymmetry in the hind limb, just as in the front limb, it's difficult sometimes to evaluate whether the asymmetry is a reflection of muscle atrophy or a damage to the muscle as opposed to asymmetry in the bony structure itself. So I would caution our listeners when they're evaluating asymmetries to be very careful in trying to discern whether the asymmetry is a reflection of muscle atrophy or whether it's actually a bony asymmetry. Now, referring back to the tuber sacrale and the hunter's bump, another aspect that can be reflected in a variation in the tuber sacrale asymmetry is a horse with an acute or chronic sacroiliac joint disruption. So that actually can be quite a serious situation that is reflected by an asymmetry in appearance of the tuber sacrale. And typically with an acute fracture of the base of the tuber sacrale, the affected side is lower. Now moving on, still standing behind the horse, the next area I want to talk about is looking at the width of the pelvis. If you took a line and bisected the horse on the midline and evaluated the width on either side of that line from the midline to the outside of the horse on left and right, those widths should be essentially equal. Now, a change in the width of each half of the pelvis is a subtle but an important clinical sign of a pelvic injury. Usually, the narrower side will be the side with the injury, and that's typically a result of compression or overriding fracture fragments in the case of a pelvic fracture. Next, another item that we'd like to look at would be swelling over the greater trochanter. The greater trochanter is essentially the point of the rump when you're looking at the horse from behind. And I would like our listeners to become accustomed to standing behind the horse and looking at this area, looking for swelling. And it's a subtle type of swelling in the grooves between the musculature and this point of the hip as you're standing from behind, or the point of the rump rather. And you may see swelling in this area 2 to 3 weeks after a fracture of the hip joint. Again, very subtle, but something that our listeners could do well to take notice of. Now, another aspect of evaluating asymmetry is feeling a horse for crepitus. Now, crepitus is what we call bone-on-bone grating. You'll hear or feel sort of a crunching movement as you're potentially lifting the leg and moving it about. You might feel that, and that would be a reflection of a fracture in a hip joint, perhaps, or very advanced arthritis. Usually that would be days to weeks after the fracture occurred, and it's something that can frequently be felt externally. It may be something that's only felt internally when the veterinarian does a rectal exam in evaluating, a substantial pelvic lameness. And it can also sometimes be heard using a stethoscope, listening to the area and manipulating the leg. Now, also standing from behind the horse, looking at the calcaneus, or the point of the hock. The point of the hock should be of equal height from side to side. And an alteration in that is a reflection frequently of an injury. And depending on the injury, the point of the hock could either be raised or it could be dropped. Unfortunately, this frequently can be difficult to evaluate because if you have a substantially lame horse, they may not be weight-bearing on one of the hind limbs, and so that can be something that's difficult to evaluate. But in more subtle lamenesses, just a good idea to get used to looking at those symmetries in the height of the hock. Similarly, we're also going to be looking at fetlock height, and we had looked at that in the forelimb, and it's just as important in the hind limb as it is in the forelimb. And I would like our listeners to get accustomed to looking at that. The fetlock height should be assessed in the standing horse and during movement. When the horse is standing, of course, he should be standing on a level surface that's even, smooth, no rocks or such that he would be standing on and fairly level. The fetlock height should be symmetrical, which would be assuring that the horse is loading the limbs equally, and that's true, again, both at rest or standing and in motion. When the horse is walking and trotting, you want to look and see how far does each fetlock drop. They should drop an equal amount on both sides. Now, a loss of support to the fetlock will cause the fetlock to drop, and that frequently is a reflection of either damage to the suspensory ligament or damage to the superficial flexor tendon. And so those are the areas I really wanted to talk about today regarding hind limb symmetry, those areas of bony asymmetry as well as fetlock height that can give our listeners an opportunity and an option to learn how to evaluate those sites and just get accustomed to looking at them and get a sense of how they can reflect lameness in the horse.
Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.